It's the Metro on WDET. I'm Robin Vincent. Since the COVID pandemic, overdose deaths are continuing to decline in Michigan. The number is dropping quickly, especially in Metro Detroit. There are a lot of possible explanations for the decline. Narcan is more readily available. The state has turned toward a harm reduction approach. And we're further away from the pandemic when people felt cooped up inside for long periods. Peer recovery coaches are also a big reason for the reduction. That work received significantly more money from the state. What does it look like to create intimacy with someone struggling with addiction and to help them recover? Pepper Cat is a peer recovery coach with the Alliance of Coalitions for Healthy Communities. That's a Troy nonprofit. She spoke about all this with the Metro's Sam Corey.
Why did you become a peer recovery coach?
I became a peer coach to definitely let other people know that there was hope, because when I found recovery myself, I was very lonely. I found recovery all by myself. I wasn't aware of any of the resources, peer coaches, the recovery community. I didn't know any of that existed. So I just went through it all until I found my people, which I did. But I want people to know before they even try recovery that there's a whole world out there that's going to wrap their arms around you and be there to help support you if you're ready for it.
I want to get into your story because I think it's a pretty important one. But before we do, I want to ask you a little bit about what the work looks like on a daily basis. What does it look like to be in the field and to be trying to help people to get to a place of sobriety?
Yeah, at the Alliance of Coalitions, we do a lot for our overdose prevention team. We offer long-term peer coaching, recovery support. And then we also partner with Oakland County Sheriff's Office and OCHN to form a crisis response unit. So we meet up with people after they've gone through some type of crisis to offer aftercare, connection to resources, connection to people. We have a social worker on our team. We also facilitate smart recovery meetings. We have a program called Resolve that teaches people about what drugs and alcohol do to the brain and find better coping skills, meditation and mindfulness and things like that.
What does it look like to walk someone towards sobriety? I know this is a complicated space and it's not easy to become sober after you're in the throes of addiction for a while. What is this process like?
It's going to look different for everybody. Some people we meet are ready to go to treatment right then, and we'll help them navigate their insurance, set up that first intake, and really walk them through those steps. It doesn't always look like that for everyone. Some people might be focused on harm reduction and using less or in a safer way. Maybe they're in pre-contemplation and not quite ready to enter full recovery. And we're able to connect with them and offer them resources and let them know there's support out there. So definitely looks different for each individual.
How do you know what someone needs? How do you identify that?
We're trained a lot, us peer coaches. We go through a lot of trainings for how to de-escalate and emotional interviewing, to really be able to talk to people and let them tell us what they need. Just talking to people and having a conversation with them, letting them know they're safe. They're going to know what they need themselves and, kind of reveal that just in a conversation.
And so a lot of it is just sitting with them, listening to them, paying attention to them, and trying to pull out the things that they need, because maybe they don't even know all the things that they're in need of at the moment.
Absolutely. There's so many times where in the beginning of a conversation, someone might not know what they need, and just talking, then they might realize that they're not connected to a primary care physician, or they haven't been to therapy in a long time. And, putting people on the spot and saying, what do you need? A lot of times we don't really know what we need. So just having that little sit down connection.
There are a lot of experts, including many health leaders in the area in Metro Detroit, who are really touting peer recovery coaches. Why do you think that is? What do you think is the most significant aspect of the work that you do?
I think because we aren't clinical, we're more relatable. A lot of people have trauma with the medical professions, or maybe they're afraid of going to the doctor, we're a little less intimidating because we're people with lived experience. We can say we've been here, we've done that. A lot of time our medical professionals have been through that, but they're not allowed to disclose that kind of information. So we're kind of like that bridge between not having any help and getting connected again with help. I consider myself like a cheerleader to encourage people to find, what it is they need to connect with.
And the folks who are struggling with addiction can see themselves a little bit in you, and you can in them. Is that part of it?
Yeah, when I let people know, that I don't know exactly what you're feeling, but I've been there. I've been homeless. I've lived in hotels. I've, struggled with substance use and alcohol use myself, and I found my way out. And that kind of gives them a little bit of hope when they're feeling really hopeless.
How often is that the thing also that allows them to trust you? Like, how often is it that they're like, yeah, I'm interested in recovery, but the people around me don't feel like they're well suited to help me get through this? How often, when you share your own story, does that change their experience?
I think it's huge. I spend a lot of time letting people know I trust these people as well, building trust with participants I work with so that I can do a warm handoff and let them know that I trust the people that I'm referring you to. We want them to feel safe in that aspect, and just saying that I've been through this. Again, like the social worker might have been through it too, but they're not allowed to disclose that.
There are a lot of different theories about why overdose deaths are declining right now. They're declining generally across the country. They're declining in the state. Big news for Celebration. We just got a report from Wayne County that they declined by 42% in 2024. But there's a lot of different theories about why that's happening. Some people say, this is just happening because we're getting further and further away from the COVID pandemic. And because of that, people are getting out into the world and they're getting the resources that they need, as opposed to not getting them before and being sort of sheltered away. I'm wondering, for those folks who think, actually there's not that much that folks can do. There's not that much that government or nonprofit institutions can do to reduce overdose deaths and alleviate addiction, that a lot of this is kind of people figuring out on their own. They might think that peer recovery coaches might be nice, but they're not necessary. What do you say to somebody who has that perspective?
I think there's still a lot of stigma out there. So I always try to educate people several times. Someone might say, I don't know someone like that, or I don't need Narcan. I don't hang around those, quote, types of people. And I just try to educate them that overdose or poisoning is not just people who actively are in an active addiction. It can happen to anyone. It can happen to anyone that's on any type of pain pill. If anyone gets something from a friend and not a pharmacy, overdose can happen to anyone. And I think it's important to be educated.
I know it's complicated and has many different sources, but what do you think helps people get more stably into a place of recovery?
I think having a recovery that is suited specifically to them. I don't think recovery is one size fits all. I think that's why there's so many different 12-step programs, and there's smart recovery and Dharma recovery, meditation-based, science-based, and they all work. It just is dependent on that person.
This is The Metro on WDET, Detroit Public Radio. I'm Sam Corey, speaking with Pepper Catt. She's a peer recovery coach with a nonprofit in Troy. We're discussing effective strategies for alleviating addiction as the state and metro area continue to reduce deaths from overdose. Pepper, I want to ask you about one element of getting people into recovery. A number of years ago, harm reduction became a really popular approach in recovery spaces. I know that you referenced it. The idea being that to get people into recovery, they need to be first kept alive with something like Narcan, and then encouraged to get treatment. But there are competing ideas and research that supports the belief that some level of coercion is necessary, that it can be helpful to incarcerate people or to force them into treatment after they've relapsed multiple times. Because otherwise, the idea goes they'll never get sober, that they need some kind of push. I'm wondering where you stand on that issue.
I think that our recovery has to be a personal choice. I know a lot of people say that, being coerced into treatment or maybe even jail, like, help them. But I don't think that that's something that you can say for everyone. A lot of us, we already feel like we don't have any control. We don't want to be forced into something. And it is all unique to each individual, like forcing someone to go to a program that you think is successful, quote, might not fit that person because maybe they just don't think in that manner. I would say almost all of us have co-occurring conditions, and I think that plays into what kind of recovery we have for ourselves.
And so you would say, alternatively, listen, the best we can do is encourage people, put the resources available in front of them, give them Narcan, tell them where they can get treatment, call on them, check on them, really try to see them and their story, and then maybe they'll decide to get the help that they need.
I think a lot of people do want help. Once we are in a state of active use where we need treatment or intervention, it's not something we enjoy. A lot of people are just trying to not feel the pain or the anxiety or the cravings or the triggers or, whatever it is that we're physically feeling, that we're doing self-harm to ourselves to try to make that feeling stop.
What is it that can reduce that pain? Like, what are some of the things? I understand. I really respect and appreciate the idea that people are individuals, they're unique, their needs are different. But I think this point about pain is an important one. A lot of people are trying to not be in pain, and substances make them feel better, at least for the moment. What does alleviating that pain look like?
For me, it was finding healthy coping skills. A lot of us don't have coping skills. That's why we are self-harming in the manner we are, because no one taught us how to self-soothe in a way that's healthy. So for myself, I had to learn that drinking alcohol or using substances, although they made me feel better in the moment, overall they were hurting me, and I had to find different ways to make myself feel better, whether that's self-talk in a positive way, or exercise, or walking my dog, reading a book, going to a meeting, doing something other than what I was doing to hurt myself.
I want to move to your story a bit. What sort of caused you to go down the route of addiction?
I didn't know for many, many, many years. I'm 10 years in recovery now. And thank you. Looking back in hindsight, it was anxiety and depression that as a child I didn't know how to verbalize. And it was trying to numb those constant feelings of anxiety and depression that I had no words for. I just knew that when I drank, I felt numb, and it wasn't as jittery as I felt when I didn't drink. And then it turned into a habit.
Mm-hmm. You didn't have a peer recovery coach to help you along the way. How did you sort of escape that cycle and get into recovery and stay in recovery?
I think that's why I want people to know about peer coaches. I was 40 by the time I found recovery myself. And
how long had you been struggling with addiction?
Since I drank unhealthy from the beginning. So I started drinking regularly probably around like 15, and I drank to blackout back then. So about 25 years of active addiction.
And that's a really long time. I mean, right, you were starting to describe like what helped you get out of that and into a different mental space.
Alcohol is a depressant, and we feel that euphoria when we initially drink, but if you continue to drink for years and days on top of years and days, eventually it just keeps depressing you. And I had depression, undiagnosed depression too. I didn't want to be alive anymore, and it really scared me. I didn't want to not be alive, but I really didn't want to be here either. And that scared me enough to go to AA. And AA was the beginning of my journey to where I am now.
And was it the fact that you connected with folks? AA doesn't take for everybody, Alcoholics Anonymous. What allowed it to take for you?
It was the connection I needed. I remember being very young and taking a drink of what I thought was a Coca-Cola that was a rum and Coke. and it was like a warm feeling. And this warm feeling that I was chasing my whole life. And when I went to a 12-step program and all these people were really encouraging me to come back and to be healthy and that it was going to be okay and that I could do this, it was that warm feeling that I had been searching for like 30 years.
It was friendship. It was connection. It was acknowledgement. Maybe it was part of being a part of something bigger than yourself.
It was something that I was really connected to rather than the false sense of that, warm alcohol feeling.
I want to hold on the warm feeling for a second because I think this is important. And I think even for folks who don't struggle with addiction, this is still relevant, which is that I think we all want to feel good, that warm sensation. And I guess I'm curious about the things that maybe you did or pursued in recovery to give you that sensation, but not to maybe hook you onto it, right? Or to that allowed you to get a sense of satisfaction without pushing you toward substances.
I think a big thing in recovery is for people to learn about mindfulness and meditation. So many of us, not just people that are in active use or in self-harm cycle, but so many of us are living in anxiety. So just like me losing my train of thought, I was living in anxiety, living in the future, or we're living in the past. We're thinking about something that's already happened, and our brain is just ruminating on this, and learning how to be present, learning how to be mindful, learning how to be in the room is a huge part of not getting stuck in those triggers and not feeling that cycle that we can't get out of.
There's one other element of addiction and recovery that I want to ask you about, which is about agency. I think generally people in the recovery space believe pretty deeply that we don't have 100% control over our fate. I think that's a fairly balanced approach. But when it comes to sobriety, I'm wondering kind of what is the agency that people have. And I think particularly what I'm asking is for loved ones trying to help their friends and family members get sober. What is it that they should be trying to facilitate in someone else to sort of pull on, to help empower them so they can feel more confident to get off drugs? Because certainly, I think most people would be like, sure, we don't have 100% control over our fate, but we do have some sort of agency. You somehow, after a long time struggling with addiction, were able to get into AA and get sober. What are the things that people should be thinking about to sort of facilitate in others so they can find some sense of agency that's good for them?
I think it's hard for friends and family. Like, watching someone you love struggle is really difficult. And the person that's struggling, it's difficult for them too. But when you are the family member or the friend, you're totally helpless because you can't control other people's actions. We get a lot of family and friends that do call in wanting help for their loved ones. And I always encourage therapy, smart recovery, family and friends, Nar-Anon, Al-Anon, some type of group that you can be around other people going through something similar.
And is that because if they get the support that they need, they'll be better suited, more stable and better suited to support the people who are in the throes of addiction?
Absolutely. All of these family and friend support groups are going to teach people about boundaries and enabling and how to not better love them, but better support them, how to love them without enabling, how to draw boundaries based on what's good for your family.
I'm wondering if you have an example of that. What does that look like to love someone without enabling? Because I do think that line gets blurred.
And that is really different for everybody, too, because it depends on the financial state, the mental state, other family members, For my family, there was a family member. I also have another family member that's in recovery. There's a rule in my house that you can't live with me if you're in active addiction. I'm a person in recovery. It's a rule that's in my house. I have known people that let people stay with them that we're trying to stop using, and at the end of it really goes on what is taking from your own mental health, what's causing someone, maybe depression or wanting to control that person. That's why I think support groups are so important, to just learn how to build boundaries, because a lot of us, we weren't ever taught how to make boundaries.
Boundaries that help keep that person sort of sane and healthy and balanced, but that aren't actively trying to hurt, I guess, the person who's struggling with addiction.
A healthy boundary should be about self-preservation rather than punishment.
I think I want to close in maybe creating a hypothetical situation. You, as we acknowledged, didn't have a peer recovery support specialist when you were struggling with substances. But if you had one at the time, and maybe particularly earlier, maybe in your 20s, what would you have wanted from them? What did you need from them in that moment?
I needed someone to hold me accountable personally. I mean, in my own journey, I needed someone to hold me accountable and help me look at myself, reflect on what I was doing, and just kind of call me out. You know, I knew when I was younger that I drank too much, but no one ever said it was a problem. So having someone, when I got arrested or a DUI at 21, say, look, I've been there. This might be a problem. You did get arrested.
Yeah. How important is it that the way they call you out, right? Like the tone. I'm wondering about that, because I can see somebody doing that and it maybe reverberating it in a bad way.
I think that's where the peer coach comes in, because if a family member does it, it's not the same, right? We need our family to support us. It's not our family's role either. Our family, it's not their role to dictate what our actions are. A peer coach, that's, you know, they're not dictating our actions, but that's what we work with them with, to kind of hold us accountable, set goals for ourselves, do that type of thing. I think the family, going back to that, we don't want them to critique us or tell us what we're doing wrong. We need them to understand that addiction is a disease and there's many cycles in it.
Pepper Cat is a peer recovery coach with the Alliance of Coalitions for Healthy Communities. That's a Troy nonprofit. She spoke with the Metro's Sam Corey. It's the Metro on WDET. Is there something you want to hear more of on this station? Tell us in our annual survey. It's just a couple minutes. It's anonymous, and it genuinely shapes what we do. What are we getting right? What would you like more of? Who should we be talking to? This station exists because people here wanted it to, so tell us what you need from it. WDET.org/survey. That's WDET.org/survey. Coming up, threats against federal judges are rising, and a group of judges says the threats spike every time the Trump administration attacks a ruling it doesn't like. A retired Michigan judge who spent 25 years on the federal bench tells us what that's like from the inside. That's next. Stay with us.